You ready? So we're going to talk about connect the dots. The dots being the belly button and then a point on the spine about 2 or 3 inches higher than the belly button. So when you're teaching your patient, you want to come in and find the top of their hip. Right over here, the innominate bone, it's actually their pelvis, not the hip. But you want to find that and then just kind of go a few inches above that spot. So if you drew a line between the belly button and that point right back there on the spine, it would be an upward and backward line. And so you just want to tap that spot on their spine and tell the patient, you're going to connect the dots. Okay, we're going to want to have you, and don't do it yet, you're going to bring your belly button towards your spine. But when you do it, you're going to take a deep breath, and then you're going to do it as you blow air out. You're going to blow air out through tight lips. So it's going to be so tight in the lips that you feel and hear the pressure. So it's not, it's real tight lips and it's pushing. So you'll take a deep breath. Don't do it yet. I'm going to explain. I'm going to do it myself. I'm going to show you, and then you'll do it. So you'll take a deep breath, and then so as I was blowing my air out, I was pulling my belly button in and up toward this spot on my spine. And then I'm holding it there, and I'm holding it for 10 seconds as I breathe as normally as possible. And after a 10-second hold, then I'm going to relax. And then after a few seconds, I'm going to start again. So I'll take the deep breath, so you can do it this time.
Okay.
So take your deep breath, deep. Tight lips, push your air. Real tight, push the air and pull the belly button in and up towards your spine. Pulling, super tight. I mean, you can really work hard on this. And then hold that connection, but don't hold your breath.
Okay.
And that's when, once you get connected, that's when your 10 seconds starts. You hold for a good 10 seconds. Then once you reach your 10, then you can relax everything. So as the technician, you're going to kind of palpate right next to the spine. And I'll probably work with each one of y'all on this. But you're going to feel right next to the spine. And so I'm going to have you do this again. So take a deep breath, tight lips, and push your air. Slowly pull the belly button. If you pull the belly button quickly, then large muscles are going to come into play, and we don't want those large muscles to do that because that's what they already do. We're trying to activate the small muscles. Okay, so pull. Did you get there? Okay, relax everything. Okay, yeah. You're good. Let's do one more. Take a deep breath. Tight lips. Push. So I have a little firm pressure on the muscles next to her spine, and as she gets tighter and tighter towards those dots being connected, I feel a firmness in those muscles right next to her spine. And hold it. And so we're activating the muscles next to the spine. They're called the multifidus muscles. They are the core muscles. Oh, I gotta work on my core. My core is weak. The core muscles are the multifidus. And relax. Okay? So you feel a little fullness in that muscle right there. If your patient's doing this and you have your fingers there and there's nothing happening on your fingers, you should feel kind of the muscle come up to your fingers a little bit. And if you're not feeling that, then they don't really have it. And they can try it for a couple of minutes, but people with back problems, they're not going to get this right away. And why are we doing this? Because they have back problems. So it's going to take a little while for them to learn connect the dots correctly. But once they start to activate those muscles, that's going to give them support of the core. And you got to have that to push, pull, and lift, and to transition in and out of positions. So that's why we teach it like this, and that's why we tell patients we want to connect their dots before they get in and out of bed or in and out of a car or push, pull, or lift, because we're stabilizing the spine before they move. And so that's connect the dots.